by community psychiatric centers and is produced for educational purposes only. It is not intended as a substitute for medical or psychological advice, diagnosis, or treatment. The content should not be used for self-diagnosis or treatment of any health-related condition. As always, seek the advice of your healthcare provider with any questions regarding a medical or mental health condition.
Welcome to Community Psychiatric Centers Presents All About Autism. Tonight we begin an in-depth look at ways to treat autism, a developmental disorder that affects an estimated 1 in every 150 children in this country. To help us, we're joined again tonight by two experts in the field. Dr. John Carasso is Clinical Director of Community Psychiatric Centers. He's a clinical licensed child psychologist and a certified school psychologist. And Dr. Robert Lowenstein is Medical Director of Community Psychiatric Centers. He's a board-certified child, adolescent, and adult psychiatrist and a fellow of the American Academy of Child and Adolescent Psychiatry. Good evening, gentlemen.
Good evening.
Dr. Lowenstein, let me ask you first. There are so many different treatments for autism. What would you say are some of the more effective treatments?
Well, there certainly are a number of treatment interventions that are now available to treat autism. It's important when you treat autism to first develop a multidisciplinary treatment plan that includes a variety of professionals and parents who come together and create a plan to meet this child's unique needs. Every child is different and they all need different treatment interventions. The basic treatment interventions that are used currently in the treatment of autism spectrum includes behavior modification, which we'll talk about today. It also includes the use of speech and language therapy, and it includes the use of occupational therapy as a treatment intervention. In addition to that, some of the symptoms of autism can be treated effectively with some medications and dietary changes, as well as play therapy interventions, sometimes called floor time, which is a technique that was developed by Dr. Greenspan, as well as social skills training and social skills interventions, which can also be helpful. Basically, the most common and the most studied form of treatment for autism is a form of treatment called applied behavioral analysis. That includes a theory, it's based on a theory that all people and organisms learn by being presented with a stimulus which they respond to through some behavior, which is then followed by a positive consequence. This is applied to children in various behavioral techniques. Two of them that are the most common and the most effective are discrete trials training and verbal behavior.
All right, Dr. Carasso, let's try to break this type of therapy down so that we can all understand it.
By all means.
What does this mean to parents? How is it used?
Well, as Dr. Lowenstein mentioned, applied behavioral analysis is the probably the only intervention that we have that is supported by the research. As Dr. Lowenstein mentioned, there are plenty of other interventions, but they're not so solidly supported by the research as applied behavioral analysis is. And in fact, we have over 19,000 studies, 500 of which are related directly to applied behavioral analysis, or ABA, and autism, citing its effectiveness. Now, the challenge, however, is that the effectiveness of the treatment, especially discrete trial, which we'll be talking about, requires extensive hours in the home, upwards of 20 to 30 hours a week, which typically is not feasible for treatment staff, which relates to the importance of parents working with treatment teams to implement these strategies. Now, discrete trial is one of the most common strategies to use to treat children with autism, and it entails teaching specific skills to children, such as, for example, pointing to or verbally identifying a favorite food item, such as a cookie, or their parents, mom and dad. We have to remember that children with autistic disorder have significant speech and language problems. such that sometimes they're nonverbal, sometimes they have difficulty making connections between an object and its name. And so the discrete trial therapy is vital to teach these communication skills because, of course, if a child can't express their needs or wants, they get frustrated, there's behavior problems, and it really reflects the need for this treatment. Discrete trial therapy entails 3 steps. The first step would entail presenting a stimulus or some type of object to the child, a cookie, picture of a cookie, whatever that may be. The second one involves eliciting a response from the child to point to the picture or say the word cookie. The third step would entail reinforcing the child for the response. Those 3 steps together constitute one trial of therapy, so that the trial is then repeated until the skill is mastered, and then the skills become more complex over time.
So we're going over it over and over
Exactly,
again.
exactly.
All right, when we come back, we will look at some tape therapy sessions that show examples of what we're talking about. You're watching Community Psychiatric Centers Presents All About Autism on PCNC. Stay with us.
As a parent, you want what's best for your child. And that can mean asking for help if your child has problems at home, in the community, or at school. At Community Psychiatric Centers, our highly trained professional staff offers mental health diagnosis, treatment, and therapy to your child in their natural environment, at home, at school, in the community, or at one of our 11 southwestern Pennsylvania locations. One phone call can change a life. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
How many elderly friends do you have? Offer a little of your time and help change the face of elder care. With its housing units, social services, transportation, and intergenerational programs, the Little Sisters of the Poor help the elderly interact with local young people. If you are interested in volunteering or donating, go to WPXI.com and click on the Champion in Action.
WPXI TV and Citizens Bank congratulates our champion in action, the Little Sisters of the Poor.
Welcome back to Community Psychiatric Centers Presents All About Autism. Tonight we're talking with Dr. Robert Lowenstein and Dr. John Carasso about types of treatment that are available for children with autism that can make a significant improvement in many of their lives. Dr. Carasso, let me just ask you a little bit about a clip we're going to see, because this is going to help us put our arms around what this type of therapy is.
Yes, yes. Discrete trial therapy can be used to address both expressive and receptive language skills. What we're going to see is a clip helping a child to accomplish what we talked about before, making that connection between an object and its name. And we'll see that in the clip, and we'll see how that works.
All right, and one of the things that's important that you stressed even earlier was repetition.
Absolutely.
All right, so we're going to see a lot of that, and here's
Yes.
the clip.
Yes.
This is a cookie. Give me cookie. Good job, Cookie! Give me cookie. Good job, Cookie! Give me cookie. Cookie, good job!
Now, Dr. Carasso, what kind of children would benefit from this type of therapy?
Well, we focus on children with autism within the spectrum. However, discrete trial therapy can help really it can teach anything to any child. It's a wonderful therapy technique, and it can be effective for children with Down syndrome, as well as the use of reinforcement, as you saw, can help any child to teach them whatever they need to learn.
And so when we talk about children within the spectrum, we're talking about children who may have mild autism to any other type of disorder along this broad
Sure. As we talked about in our first show, the idea of autistic disorder through PDD, through Asperger's disorder. However, discrete trial typically is used for children lower on the functioning scale. Typical autistic disorder through lower functioning PDD.
All right, Dr. Lowenstein, I understand these drills, they can become more complex.
Yes, in fact, they need to become more complex in order to challenge the child to learn increasing steps of behavior that need changed. There are distractors that are often added that help the complexity challenge to go higher, and then there is hopefully a generalization of that success into the community outside of the session. I think we have a clip that also demonstrates that.
All right, we're going to take a look at that now. This is as the drills become more complex.
Yes.
Cookie. Good job, Cookie. Give me Cookie. Good job. Give me Cookie. Good job, Cookie. Cookie.
All right, tell me a little bit about what we were seeing there. Obviously, it was becoming more complex. The therapist was moving around the cards.
Yes, in the first clip you saw there was only one card that was presented to the child to identify what that card was, a cookie. And for that the child got a reward, which helps to reinforce their ability to say cookie or point to a picture that was of a cookie that they couldn't say. The second clip is more complex. It has a variety of cards, and therefore the child has to choose between those.
What is this helping them do?
It's helping, well, in this situation, this is receptive language. It's helping, again, for this little girl to make a connection between an object, in this instance a cookie, and the name of the cookie. So when she wants a cookie, she'll be able to say, hopefully at some point, cookie. Now that's down the road, that's expressive. This was receptive. So the idea of this would be that she's able to identify, oh, okay, if I want a cookie, I can point to a cookie and I can get my needs met, as opposed to becoming frustrated and having a tantrum and having difficulties communicating her needs and wants.
What we're trying to show by these clips is how difficult it is to teach children with autism simple things like being able to identify an object, being able to name simple things in their environment, and that this requires an enormous amount of time and effort by therapists and parents to teach them the smallest steps in being able to accomplish
If I may add,
self-help skills.
Sure. We had talked earlier about how this type of therapy in the research, in terms of effectiveness, is at 20 to 30 hours a week. And so you can see just how intensive it is. Now again, that's not always feasible, but there are ways of promoting effectiveness otherwise, to working, having the parents complete the drills, and other ways such as verbal behavior, which we'll be talking about, can also supplement.
If a child really seems to adapt to this and work with this, and if the parents do that reinforcement, how much improvement can be made?
Every child is unique, every child is different. Some children can have enormous amounts of success and others not. But it's important that the treatment plan for every child uniquely addresses their specific needs.
Yes. Well, just that the therapy, one thing to take note of is Heather, the therapist there, is one of our autism specialists. And you notice that during the therapy sessions, she was being highly enthusiastic, voice intonation changed over the course of the session. And that helps tremendously to keep the child's motivation and enthusiasm and attention, which can be a challenge, especially given the length of the treatment. So those factors are very important.
All right, we're going to take a short break. When we come back, we will be looking at another type of treatment called verbal behavior. More on Community Psychiatric Centers Presents right after this.
Every parent has sweet dreams for their baby, but what happens when the unexpected happens? When a child develops slowly, has trouble talking, or withdraws into a world all by himself? Today in America, an estimated 1 in every 150 children is diagnosed with autism. And while there is no known cause and no known cure, an early diagnosis can make a major difference in an autistic child's life. At Community Psychiatric Centers, Dr. John Carasso and Dr. Robert Lowenstein have more than 50 combined years of experience diagnosing and treating many thousands of children and adolescents with autism spectrum disorders. They, along with their highly trained professional and caring staff, can evaluate, diagnose, and treat children and adolescents who may be having problems at home, in the community, or at school. If you believe your child needs help, call 1-877-899-6500 for an evaluation at one of our 11 convenient locations in southwestern Pennsylvania. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
Welcome back to Community Psychiatric Centers Presents All About Autism. Tonight we continue our discussion about treatment for children with autism. And Dr. Lowenstein, we're going to be talking about verbal behavior. What exactly is that?
Verbal behavior refers to a book, first and foremost, written by Skinner in 1957, in which he basically postulated the idea that the development of language is mediated by behavioral consequencing that a child experiences from others. It also refers to a applied behavioral analysis technique called verbal behavior, in which a child is taught language skills using the same antecedent behavior and consequence system that we described before.
How complex is this? Is it very different from what we just saw, where there's that repetition and cookie and the pictures?
Well, in some ways it is. It supplements discrete trial. Discrete trial, as we saw, was very regimented and precise and discrete. Verbal behavior, what's great about it is it's far more free-flowing. In many respects, it's more fun. It's done in naturalistic settings. It can be completed by a parent anywhere, anytime, any place, which is so nice. It's again much more free-flowing than what we see in discrete trial.
All right, we have another clip of verbal behavior, and how can this be used?
Well, what we'll see here, this is during unstructured time. This is during a therapist and a child just involved in puzzle building. During the puzzle building, the child requests for a cookie and says cookie. However, we want more than a single word expression to get a need met. We want the child to say, at the very least, I want cookie, and we'll see the therapist prompting for that. We'll also take note of the therapist giving only one small piece of the cookie at a time, which then allows for more prompting, as opposed to giving all the cookie all at once. And we'll see how that plays out.
All right, let's take a look at the clip.
I want cookie.
I want cookie.
Very good.
Now, what we're looking at,
Okay, one moment, we'll see.
I want cookie.
Very good job, cookie.
And there you have it. And
Okay.
what we saw was her expanding from cookie to I want cookie, which is, of course, that's the goal, is to expand verbal communication. We also notice that as she prompts in that regard, it's fun. These activities are fun. They're on structured time, and they can be done anywhere, anytime, any place. And a parent can do that in the home throughout the day and the week.
And also, we should add that the consequences of the positive reinforcer doesn't have to be a cookie all the time. It can be praise, it could be playing a game, it could be anything that the child really appreciates getting as a positive response to learning a specific skill.
it would seem that positive reinforcement would be just a basic thing, but it really is important, isn't it? Especially working with autistic children?
Very important. That's the basis of the behavior modification treatment approach.
And have parents found that, you know, if saying stop doing that or don't do that, or that just confuses the child even more?
Well, yeah, it's fascinating. Going back to discrete trial, one of the problems that can present is if a therapist, because the child at some point is going to choose incorrectly, and one of the strategies that we espouse is errorless teaching, which is the strategy of the therapist taking the child by the hand as needed and guiding them toward the correct response, as opposed to saying no. Saying no tends to frustrate, it tends to result in a lack of motivation in the child, and that's exactly what we don't want.
Do schools tend to offer this at all, these types of therapies that we're talking about?
Well, no, schools actually don't usually offer these techniques or these interventions. However, there are a lot of things that children who are engaged in these treatment interventions can profit from while in the school setting. We also provide therapists that work with children in schools to help them through the day. They may stay with them in class to help them stay on task. They may help them to be able to deal with transitions from one task to another, and may be able to improve their social skills and being able to play with peers.
Dr. Rosso, how important is that to have this therapist kind of shadowing them through a school setting?
Well, it can be vital. Some children couldn't be maintained in the mainstream setting without having a therapeutic staff support worker with them to guide them and prompt them and support them during the daily routine. Now, a therapist in the school wouldn't as Dr. Lowenstein mentioned, would not be carrying out discrete trial regimens in this classroom setting. However, what they would be doing is breaking down tasks into more doable objects, and also the idea of providing high levels of reinforcement for the child's behavior to keep them motivated, because that's what maintains motivation, is the reinforcement.
Can you see a big improvement in some children? We were talking about that earlier, but what length of time would it take for I guess it does vary greatly by the child, but what length of time are we talking about?
Well,
long term?
Yes, absolutely. And as Dr. Carasso had mentioned earlier, these children are in treatment sometimes 20 or 30 hours per week. In addition to that, their parents work with them after those 20 or 30 hours a week. So it's a very intensive treatment program which can last for years.
Who educates the parents on how to do this?
The team, that's vital. As we mentioned before, parent involvement and participation in carrying out these drills, carrying out the verbal behavior techniques throughout the week in the absence of staff is vital. So it's important that the team work very closely with the parent to help them learn these skills, which are not that difficult. I mean, those we saw them, very doable, but very practical in many respects, and a parent can help tremendously.
The most important thing that parents can do also is to help work with their children to learn some of the social skills and some of the personal skills that they need to achieve, like being able to brush their teeth or get dressed or put on their shoes.
Sure.
How important, what are the benefits, I guess, for the parent who may have been very frustrated because they just couldn't communicate these things before? What kind of things can the parents see right away?
Oh, it's wonderful. I mean, the parents are so appreciative of the service and what it can accomplish. A child who at one point, what we hear most commonly is a child who initially, with the treatment starting out, was tantruming and presenting with all types of behavior problems, and within a period of months, far more compliant, far more pleasant and happy, because now they can communicate their needs.
I would think, even in terms of when you're dealing with a child who doesn't have a developmental disorder, just saying no all the time just doesn't seem to always work.
It doesn't. These principles are applicable to all children. The principles are.
Also, the reinforcers are positive reinforcers.
Yes.
They're not negative ones, which would not be helpful.
And keep in mind, it's not always speaking of verbal expression to communicate needs. It could be sign language. It could be something that we're going to be referring to in weeks to come, a picture exchange program. But ultimately, our goal is to increase verbal communication.
All right, when we come back, we will take a look at some email questions you've sent us right after this. Stay with us.
As a parent, you want your child to reach his or her full potential. For children with autism, early detection and treatment can make a world of difference in your child's life. At Community Psychiatric Centers, our autism unit is led by two highly trained and experienced mental health professionals, Dr. Robert Lowenstein and Dr. John Carasso. Their expertise in the field of autism spectrum disorders means you and your child will get individualized help you need every step of the way. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
Every child deserves a litter-free school. You can help keep Pennsylvania beautiful by picking up trash as part of this year's Great PA Cleanup. Last year, Pennsylvanians picked up nearly 7 million pounds of trash. With your help, we can do better this year. To help keep your neighborhood school litter-free, register your group or find a group in your area at our website and help us.
Welcome back to Community Psychiatric Centers Presents All About Autism. As promised, we are going to go into our email bag and take a look at some of the questions you've emailed to our doctors. And here is one. What training does Community Psychiatric Centers offer to prepare staff to implement discrete therapy and verbal behavior programming, the two types of therapy we were talking about tonight? Dr. Lowenstein.
Well, we do have a highly professional, skilled staff that include therapists that are trained to perform discrete trials training and verbal behavior treatment. And we have on staff as well a behavior specialist analyst who also supervises and trains the treatment staff.
We talked before about how these strategies, like discrete trial and verbal behavior, are in some ways simple, but in other ways they're rather complex, in the sense that we'll be taking a look at other interventions, and we talked about some of them tonight. The idea is to combine treatments and put them all together and use them in a coordinated, integrated fashion. And that's not entirely easy to do. And so we go through great pains at community psychiatry to ensure that our staff is trained. We have a lot of oversight. We have autism specialists writing the treatment plans initially. Dr. Lowenstein and I overview them. We also have a board-certified behavioral analyst, as Dr. Lowenstein mentioned, overseeing those treatment plans as well. We provide trainings and supervisions on a monthly and weekly basis. And so again, lots of oversight to make sure that the staff can meet the needs of the child and individualize those plans.
And you're talking about individualizing, which I know you stressed earlier, but when we started, or when I was preparing for this show, I went on the internet and I was looking up therapy, treatment, autism, and out comes this gigantic list. And we've only just touched on 2 today.
Yes.
Some of the other ones that I thought were just fascinating were dietary restrictions, gluten-free food, medicine, medication.
Right.
There were just so many different things. We're going to touch on a lot of these.
That's correct. In the future weeks, we're going to touch on the other treatment interventions for autism, which can include, as you mentioned, the medications that are used to treat autism, the dietary issues, speech and language therapy, occupational therapy, social skills training, and playtime type therapy, which are all very helpful and somewhat complex. It's important to note that one therapy alone doesn't work for all children all of the time. It's important to come up with a functional analysis for each child in terms of what their needs are and apply a treatment program that meets those needs for that child.
How long does it take you to figure out what is the best plan for this individual child?
Well, it's a process, and it's a treatment planning process. The team will gather data and information initially and put that together over the course of days and weeks, and hopefully come up with a workable, very effective plan within a few weeks. That's something that is directly put together to meet the needs of that child.
How important is parental feedback as the child is going through this treatment? You know, the therapist might see the child for 20, 30 hours a week if they're in this.
Oh, it's enormously important.
It
The
is.
parents need to be involved from beginning to end, and we rely upon them to be part of the treatment team and part of the treatment process.
And it's vital that those skills that we speak of in terms of implementing these strategies, as I mentioned before, are carried over to the parent.
All right. Again, if you have any questions, doctors, thank you so much. If parents have any questions, they know that you can go to the website and email the question, or you can schedule an appointment. The web address again, www.cpcwecare.com. Thanks again for being with us, Dr. Grosso, Dr. Lowenstein, and we will see you all next week. Thanks again. Thank you for watching.